My daughter, when she woke up in the morning after a good night's sleep, she would start coughing. And all of a sudden, one day, I heard a fall. I went running and I found my daughter on the floor in the kitchen. I panicked. I was trying to get her to move. Nothing happened. I called 911. But eventually, she did come out of it. After that happened, it progressively got worse. So I went to several doctors, and there was unquestionable doubt that she had a disease called Moyamoya.
Moyamoya disease is a relatively rare condition where the blood vessels of the brain actually begin to narrow down and close. It often causes hemorrhage in adults, and they present with symptoms and signs of stroke. Could be weakness, speech difficulty, visual problems.
So I took her to a very special neurologist who did an MRI of her brain. And my family and I and my daughter went to meet Dr. Langer and consult with him with the results of the MRI. I sat down, I was very nervous. My family was nervous. I knew and looked up the disease on my own, and I saw the severity of it, which even made me more nervous.
Certainly there are complexities to the medical diagnosis, and there are complexities to emotion. And what I say is not always what the patient hears. And what the patient says and asks, they don't hear back. Whether you have a hangnail or a brain tumor, it's your problem. And there's a fair amount of emotion built into that interaction.
When the patient is sitting in front of the computer and we walk them through what we see, oftentimes we found when they leave, they don't retain the information. This made us think about starting to record it, creating the virtual office visit.
And so we were starting to experiment with screen capture, which is basically recording your screen in the patient space. So I would record a screen while I was talking to a patient, and then I would review their MRI or their CAT scan, and then they'd have a movie that we could send to them.
So a virtual office visit is a memorialization through recording the computer screen of when you come into the office and we show you information on our computer screen. When you're home or away, you can then view that recording at your leisure, anytime, any place, and see what you saw there and hear what you heard there in the office visit.
And that's the original intent, was to make a much more robust, sort of informative, patient-specific video that really represented the highlight reel of their case.
After the consultation was over, we left. I had no idea what went on in the consultation. That's how numb I was. This is my daughter. This is her life. Dr. Langer said, when you go home, you will be getting an email from me. Look at the email, and there'll be a film of the whole consultation on there. When I got home, I opened up the link, and I was totally amazed. The whole consultation, the whole MRI was right in front of my eyes in my own home.
When we first started creating these virtual office visits, it was extremely rudimentary. We started by just having a singular application that could record the screen, and then we would save the video, and then we would publish it to the internet.
And so we were doing that for a few years. I was so compelled by this project and felt it was so important to be able to try to do this, in a healthcare system. We want to make it much more like what you're used to at home with the Apple Store and downloading an app and then seeing, what it is that you're looking for.
As we got more complex, we decided to kind of measure and build our own. Starting with a blank piece of paper, dreaming up what could really help influence patient care and move the needle, and design to those specifications.
And we're continuing to push the envelope on both the creation side for the provider, like what the provider actually does in their workflow to make compelling pieces of digitized data, as well as the consumptive side.
I was able to view and reverse and forward, and all the questions I could have had and would have had to call Dr. Langer about, I didn't have to. Everything was answered on that podcast. It prevented a lot of anxiety for me. I have a special needs daughter, and she's my life to me, so it made me feel comfortable. And the results to her surgery ended up being positive, and she is getting blood flow to the brain. So as of today, she's fantastic. She's a very, very special girl.
From the idea of a single screen recording, a virtual office visit, came the idea of not just a single recording, but several recordings and documents and things pulled from the electronic medical record to create different chapters in essentially what is an electronic book on your mobile device or on a web browser. By taking this information and making it into something more consumer fit and finish, we can deliver healthcare information to the patient that helps them become informed and empowered to help them to wellness.
I think we're going to make a major contribution to the way patients experience their world in the hospital and what they end up going home with, and the way they learn, the way they can ask questions. We know that video also is remarkably better at transporting knowledge, that the combination of audio and video have been shown to be more beneficial to learning. And so when you add it all up, ultimately, to create a very patient-specific, granular platform with chapters that's really about them is why this is so powerful.